National Nurses Week is celebrated from May 6th to the 12th. It's a week that recognizes the amazing contributions that nurses make to the patients and to their communities that serve. Today, we'll explore the evolving role of the modern-day nurse.
You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I am your host, Dr. Mohan, and today I have a very special guest and a good friend of mine, Rebecca Bledsoe. She is here to talk about Nurses Week and nursing at large at Mosaic Life Care. Welcome, Rebecca.
Hi, happy to be here.
Nurses Week.
Yeah.
It's a big week for nurse, right?
It's my favorite week.
Is it? So out of curiosity, how many nurses do we have here in Mosaic, the whole system?
Yeah, we have over 1,400 nurses, RNs and LPNs between our whole systems.
That is a tremendous, tremendous number. And as a physician, and not that it means anything, but I just want to say thank you to all the nurses. Mm-hmm. Without you, my butt would be toast. So thank you. So Nurses Week is a entire week dedicated to just nurses and their amazing work that they contribute to the patients and their communities. What kind of festivities do you have planned for this week?
Sure. We have a nursing committee that has helped us plan out several events. So each day has a theme of different things we're doing. T-shirt Tuesdays, an example.
Nice.
New this year, our nurses requested to bring in some outside speakers just to lift nurses up. It's an optional thing that allows nurses to come and step away from their everyday business and be able to listen to a couple speakers. This year, we're bringing in someone to talk about incivility in the workplace, and then one just about you, getting rest, taking time out for yourself. And then we also have a big dinner celebration on Tuesday that will recognize all of our Nurse Excellence nominees.
Excellent. And what day is that Tuesday?
Tuesday the 7th.
Of May.
Of May, yep.
Excellent. So, you know, at Mosaic, the highest award nurses can achieve is the Nurse Excellence Award, correct? Tell me a little bit more about the award. I heard you had a record number of nominations this year.
So this year we've had over 150 nominations, which is a record year for us, and that's RNs and LPNs. These are nurses who were nominated by another caregiver here at Mosaic to lift them up. We have 6 awards that we are giving out this year. We have 4 Nurse Excellence, Nurse of the Year awards that will be one from each entity. So one for Maryville, Albany, LTAC, and one for St. Joe. We also have a Rising Star, which is a nurse who's been less than 2 years in the nursing field, who's just really stood out, and then an Educator and Mentor of the Year, and usually nominated by someone who had the experience of learning from that nurse over the last couple years. And so those are our nominations, and we are evaluating nurses on the 12 core competencies that's in our professional practice model. A couple of those are leader, professional, accountability, being an advocate, a collaborative. There's several out there.
Yeah, absolutely. And all of them are very applicable in this day and age for any nurse. Not that it wasn't before, but I feel it's more necessary for nursing staff to embrace leadership as part of their normal day-to-day.
Yes, absolutely.
So you've been a nurse for quite some time, is that right?
Yeah, you're aging me, aren't you?
I promise you, this is not a baiting question. This is just a more of a fact-finding. You know?
I have been a nurse since 2002, so 22 years.
So you were 10 years old when you started.
I was 10 years old. Yes, absolutely.
The world's youngest nurse.
I've been my entire career here at Mosaic, on top of some outside roles I've had through the last several years.
So how many years? 22?
22 as a nurse, as an RN.
Oh my goodness. And what have you noticed from the time when you started nursing school to what the nurses are seeing now?
Yeah. Oh, wow. That takes me back.
That might be the one.
So when I was right out of nursing school, nursing was a very hard profession to get into. You were really lucky if you got into nursing school the first time you tried. And so the waiting lists were long to get into a nursing school. And then positions were hard to find too. So most nurses started out on nights, and you were lucky to get the position you wanted. And so today it's completely different, right?
Right.
The other thing is everything was paper.
Oh boy.
The good old paper days.
I'm of that generation where I saw the transition from paper to electronic medical record, and I cannot tell you, I miss the paper days on most days, but I can also tell you that electronic medical record has made a lot of things easier. Now I can finally read that, endocrinologist's note.
Yeah.
Shout out to Dr. Warman, who was my old mentor in endocrinology. He is not listening, I can tell you that. But so a lot of changes has happened since the last 22 years.
For sure.
And you mentioned something which is kind of fascinating to me, which is nursing was it's not that it's not competitive, but the jobs were very hard to find back when you started. And right now, with our supply and demand sort of labor force that we're in, that has completely changed.
Yep. We have national nursing shortage across the country, and multiple countries are having national nursing shortage.
And it's going to be like that for quite some time.
Yeah.
I don't know if the statistic is true or not, and you might have to keep me honest, that there might be, in the next 5 years, 200,000 nurse shortages or something along those lines.
It's quite a few. If you look at the country, it's probably more than that.
Wow.
I'd have to pull the statistics. But we are making progress, and we are seeing more people now. There was a stall for a few years, especially during COVID.
Sure.
Start to get back into the healthcare arena and want to follow the nursing
pattern. And
pattern.
I think the pandemic really sort of shaped or brought this issue of supply and demand to a full, head to say, hey, from my anecdotally, I can tell you a lot of nurses that I knew pre-pandemic and post-pandemic, if they were not already looking to exit the profession, I know they have, or they've looked to go advanced degrees to APRN or nurse practitioner. Have you noticed those factors make an impact here at Mosaic?
Yes, I do believe we've seen an increase of nurses wanting just to get out of the nursing field in general. I think some of that's starting to turn a corner and come back, where people are starting to step back into nursing. But burnout's a real thing, and
Sure.
the last several years have been very, very hard on nursing. So between the pandemic and then working short because there was significant staffing gaps, we're not out of the woods yet. We
Sure.
still are working through a lot of staffing issues, so navigating that. But I do have hope, and I do believe we're moving things in the right direction.
I echo that sentiment. I truly believe that we're turning the corner on how healthcare landscape looks in general. I promise you this is not a pandemic sort of a podcast, but it can be, because for nurses and LPNs and that labor pool in general, I hate to call them labor pool, I call them the core team, that was a big thing. Post-pandemic, a lot of them just felt burnt out. They're like, I just don't have it in me to take care of myself and then translate them taking care of my patients. So a lot of them were just sort of going through the motions because bills don't stop and student, loans don't stop and all those things. Well, they stop for a little bit, but not permanently, So what does the incoming nurses landscape look like? If I'm a nurse entering nursing school in 2024, what does the future hold for me, especially if I'm from this region?
Well, I don't want to tell you it's easy, because nursing's hard, and nursing's hard work, and I think if you know that coming out, it's easier to embrace. There will be blood, sweat, and tears, but at the end of the day, there's also joy and reward. I think for new nurses coming out, it's exciting time, because you have decisions. Like, you can go any path you want in nursing: inpatient, outpatient, day shift, night shift. It's endless possibilities.
Mid-shift, weekends only.
Flexibility and a lot of different choices that you have. And I often have conversations with nurses who may be feeling a little burnout, or they've felt like they've lost their passion. But there's something really exciting with nursing, is you can find a new passion any which way you go, because there's so much you can do with it. So trying to refine that, and where's that passion reside with you. The other thing is, it's exciting. Technology is moving so fast. The next couple years, it's hard to fathom where we're going to be at. The use of AI and the technologies, I think we are heading in that direction.
Absolutely. I'm really curious as to the whole machine learning aspect of healthcare. A lot of people that I talk to, there's two camps of it. One of them is, I don't want machine learning or AI as part of my medical journey. And then they have as well, if it takes, time management to the next level, where I can have more me time, where I can work on my own, priorities in life and not just be focused on my professional role, they're embracing it.
Sure.
I think it's kind of like the internet before it became the internet, which is like, what does it mean? And it went from a simple AOL messenger to whatever it is now, a giant, industry into itself. I think there are some pros and cons,
For sure.
and how we step into it as a whole. is going to be a lot more important down the road. But I think you're absolutely right. The technology is just churning faster than we can keep up. So just to pivot a little bit, so we know the future may be AI supported, might not be. It's an exciting time to be a nurse, to see different avenues of life. You can pick and choose different aspects. Was this something you had a luxury of when you were coming into the profession?
As far as
like picking and choosing what you wanted, or you were just...
No. When I started, I was very limited, and I was very fortunate that I had started my journey here before I was a nurse, and so I had a foot in the door. But if you didn't have a foot in the door, you had to go one path pretty much, and that would have been night shift on a med-surg floor.
Pay your dues, so to say.
Yeah, and so times have changed. We don't necessarily have that right now.
And do you think that's for the better?
I don't know that it's for the better, but I do think, I do believe that nurses want autonomy, and they want decisions, and they want to have a voice in what they do every day. So I fully support it from that aspect, but I also want to make sure our nurses feel like they're equipped to safely take care of patients too, and not rush them any which way, and slowly learn versus piling all the expertise on all at once.
And that's a very good point. You know, the growth of any medical professional, you know, with fair amount of flexibility comes also a fair amount of learning different practices and different patterns from other colleagues, mentors, you know. How can Mosaic support, you know, or how does Mosaic support the nurses' competencies and their wayfinding through all this?
Yeah, so I think we need to, and we're getting better. I think it's been a couple years of maybe pushing people a little harder. Take the time and be flexible with the different learning avenues, and making sure that our nurses feel safe to take care of patients before we just let them fly on their own. So.
Right. And then that's a two-way street, right? You know, the willingness to learn, the willing to participate, the willing to teach. I think without good mentors, without good leadership, I think those can kind of go on the wayside to a certain degree.
And I do believe, and just to add on a little, is with the staffing shortages, we've made significant improvements. It's a commitment I have, and it's one of my top priorities to keep working towards, because I truly believe if our nurses can have safe patient ratios, it's a better learning environment. It's a better environment for quality care, and so keep pushing to where we get where we want to be. 2 years ago, I said it's going to be 2 years before we feel like we're digging ourselves out of the hole we were in, and we are here, and I see the light. I mean, we are making huge progress, and hopefully by this time next year we'll be talking again and saying, oh my gosh, look at where we're at, and we've filled so many of our gaps, and things are looking very promising for our nurses.
Yeah, a true improvement is like boiling water. It takes a whole lot of time to get it done, but once it hits that temperature, it goes to the next degree and it starts boiling. So I resonate with that. So Rebecca, tell us what type of pipelining do you have in place for our nursing staff in general?
So pipelining is always a work in progress. We have seen most success with Grow Our Own. So working on a few different initiatives to help get students in sooner, because we find out when we bring them on, they want to stay with us a lot of the time. So we are partnering with our local college, local university to try to ensure we're helping fill seats for them, because if we know we can get more nursing students in, especially local, it usually benefits us in the end. So that's one thing we're doing. Another thing is we've really leveraged working with our international companies, and we have 65 international nurses that we have signed for this year.
Where are they coming from?
From the Philippines.
Excellent.
And there was a little slight delay with some visa issues that has since moved, and so we have really a steady stream of nurses that will be coming in. They commit to 3 years with us.
That's a long
bring
time.
Their families, and our goal is that they settle here. They want to have their families here and be part of our community, and super excited about that.
Yeah.
The other thing we're trying to do, and we'll probably have to work on a little bit more, but over the next few years, is really team medicine. Maximizing scope for everybody who is taking care of patients, so then we can leverage the different team-based approach to making sure we're taking care of patients. So those are just a few things. It's always work in progress. Always looking for opportunities to enhance what we have going on, but always open to ideas too.
Absolutely. And that's a great great way of looking at things as the collaboration to help in anything we can do to improve our patients' care. Touching on the international nurses, you said 65 are coming from the Philippines.
Yes.
What are we doing as a community here in Northwest Missouri to support them?
Yeah, that's a good point, because when the nurses are coming here, they are bringing their families. Some of them have kids, and so I have to give a shout out to our nurse recruiter, Dominique Protzman. She has done a ton of effort and work, and it's really made it a passion of hers to make sure the onboarding process is as smooth as possible. There's a lot of other people, our HR team, the nurses on the floors that have helped, but at the end of the day, I have to give her a shout out. There's a community event that she has helped put together that has brought a safe place for the nurses to come and mingle and meet each other, and then they brought in community members, so bankers and car dealers.
Sure.
You think when someone comes to our hospital and they're settling in our community and they have 2 suitcases, there's a ton of stuff they need just to get settled in. And our nurses are all donating items to help support and build up their furnishings of what they have, and Dom has led those efforts. So
Excellent. So kudos to you, Dom, for the amazing work that you've been doing. And I'm sure the nurses that are incoming would surely appreciate that.
absolutely.
So this is your special week,
Yeah.
right? What parting message do you want to leave with Mosaic nurses and all the nurses out there nationwide and the tens of thousands of all the listeners to this podcast?
Yeah, so okay, I have a couple of thoughts on that, and I made some notes on it so I wouldn't forget, but I just want to say thank you. I want to say thank you to each and every single one of our nurses for the work they do, their contributions, their compassion, their passion to take care of patients. Because of you, our patients are better. We're able to serve the patients we do, and I just want to say thank you. And their kindness, their hard work does not go unnoticed. I know oftentimes we don't get to say thank you enough, but it's truly appreciated. The other thing I want to do is nursing is a team sport. So I know we're recognizing nursing this week, but nurses couldn't do it without our team members. Right. From everybody from our physicians to the techs to even our billers, it takes an entire team working together to make sure patients are taken care of, dietary, EVS. So I know I did not call out everybody, but every single caregiver deserves a thank you, because it really is a team sport, and I just want to say thanks for all they do. But I do want to bring us back, and I don't know if I mentioned this earlier, our theme for Nurses Week this week is Nurses Make the Difference. So I just want to let that sink in. They certainly do. Nurses make the difference, and it's from inpatient to outpatient clinic, to our nurses who go in homes, our nurses in quality and documentation and informatics, our nurse leaders, RNs, LPNs. We have a ton of nurses in our system, so I just want to say thanks for all you do, and happy Nurses Week. And then I do have a couple quotes, because I always like to end on a fun little note.
Love it.
And I chuckle. Sometimes I need to lift up, and I Google different quotes. And so here's one. Actually, I have 2 I'll leave you with. People often say that motivation doesn't last. Well, neither does bathing, and that's why we recommend it daily. So, and our nurses will chuckle at that, because our daily recommendations of taking baths is so important. And then once a nurse, always a nurse. No matter where you go or what you do, you never truly get out of nursing. It's like the mafia. You know too much.
Very funny quotes, Rebecca, and I cannot agree more. Once you're a nurse, you're always a nurse, regardless of where you find yourself. And I know it means nothing in the grand scheme of things, but it means a lot to me. I want to thank every single nurse out there that has helped me become the physician I am. My best mentors in residency were nurses. They're the ones who helped me with how to draw blood, put in Foley's, do all the things that are considered to be, essential part of caregiving, total nursing in that sense. And they were my first mentors. Absolutely. So I am where I am because of nurses. So I want to thank them from the bottom of my heart, and our patients certainly are thankful for them. And there you have it, folks. Nurses Week is coming up soon. We have Rebecca Bledsoe, our Chief Nursing Officer, here with us, and she shared some of her vision and her growth throughout the years and how she started as a nurse 22 years ago.
22 years.
Not to age you, but just to recognize the contributions you've made and how you've been in this role. And I can just say, as a friend, as a peer, you're doing a great job. And our nurses are very thankful that you're at the helm leading them, because It's one thing to talk the talk, it's a whole different to walk the walk, and you certainly are. So, to all the nurses out there, thank you once again. I'm your host, Dr. Karan Mohan, and as always, take care and brush your hair.